some TLC to your HEART. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back to your Smarter Heart University. Our final segment. Answer to your top question number 3. Gloomy and socially inhibited people with PAD have 2, 3, and 4 times higher mortality risk. Well, patients with so-called type D personalities, they have negative emotions and inhibited self-expression in social interactions, have a 3-fold greater risk of death, the 3 times greater risk of death. This follows suit with our emotions in the heart show that we did, where the big three negative emotions, the anger, hostility, the depression, negativity, and the stress, anxiety emotions, all build up plaque and bad things result. Go listen to that one, guys. It's still one of my favorites. So what can you do about it? Our part 4, as we always do, PAD section. I think we've established for all of you that the diagnosis of PAD carries with it a significantly heightened risk for adverse cardiac events, including dying, heart attack, and stroke. I think we've established that. I think anybody who's listened to this for the past hour knows this. We have also established, again, same thing, that the earlier the diagnosis of PAD is a serious preventative and public health goal and should be an initiative.
Yes.
Since the typical pain on walking or claudication, also our third point here, symptoms are only present in less than a third, less than 30%, we recommend to you the following. Get your pencils out. You should have an ABI, definitely, if you are the following. Number 1, if you're an age less than 50 and have diabetes and at least one of the following. You have a history of smoking, you have abnormal cholesterol, or you have high blood pressure. That's it, number 1. Number 2, if you're 50 or older and you have diabetes, got to have an ABI. Number 3, if you're 50 or older and you smoke or used to smoke, absolute. Number 4, definitely anybody over 70 should have an ABI. I think now we've established that fact that 35% are going to have vascular disease.
Yeah.
Number 5, if you have one of the following symptoms: fatigue, heaviness, tiredness, cramping in your leg muscles, either in the calf, the thigh, the buttocks, that occur with activity and go away with rest, absolutely an ABI should be done. If you have foot or toe pain at rest, that often disturbs you from sleep. It wakes you up. We see this a lot, Bob, don't we?
Yeah, we do.
Okay, you should have an ABI. And lastly, if you have some skin wound, not an ulcer, but definitely an ulcer, but even if you have a red mark, but definitely ulcers on your feet or on your toes that are very slow to heal, they're just not going away, and you say, what is that? Oh, I bumped myself. You know what? Look to see if maybe you should get an ABI. Now, current treatment options for PAD beyond modifying your risk factors and changing your lifestyle. Number 1, supervised exercise programs and rehab. 40 to 60-minute sessions to the point where your symptoms stop you from exercising need to be accomplished first. This is what the guidelines say. This has been shown to improve your walking time better than Dr. Kaiser doing an angioplasty of your legs, and is always recommended first before any intervention or surgery. Second, medical therapy after an aspirin or the clopidogrel Plavix is instituted, especially if it doesn't work. Cilostazol, which is Pletal, P-L-E-T-A-L, is approved by the FDA to suppress platelet clotting and dilate your arteries in the PAD system in patients who have claudication. They have exercise-induced pain. 100 milligrams 2 times a day has statistically shown significant improvement in symptoms in terms of not having as many symptoms and being able to walk farther. They recommend a 3 to 6 month trial before proceeding to an intervention or surgery. Next, endovascular intervention with Dr. Kaiser and other cardiologists, or surgical management of the vascular surgeon, like angioplasty or bypass, is recommended for urgent cases of limb-threatening symptoms like pain at rest or ulcers or gangrene. That's well established. Well established. Perfect. no significant response to exercise rehab or the medical therapy with the aspirin, Plavix, or cilostazol, Plital, definitely you should proceed towards one of those repairs. Or lastly, if you're disabled by the claudication or the symptoms lead to an inability to just perform your normal work or your normal activities, you should go to an interventional cardiologist or a vascular surgeon. Now, beyond this, real quick, the future for PAD. We talked a little bit about ginkgo. The jury is really still out, but one trial last week we talked about that has showed improvement in walking distance in people with PAD, so that's something that you may want to try if you have this listening. There's 4 investigational medications out there, folks, in development to increase walking distance. And then lastly, therapeutic angiogenesis is out there, folks, with the heart, for the legs, for everywhere, using something called growth factors to stimulate the development of helper or collateral arteries around the blocked main arteries to improve the blood flow. I thought that was really good. We did have a family doctor write in and said the family doctor has to make a correlation with high-risk patients, that he or she must perform coronary tests, but also must check the carotid and all PAD tests. And unfortunately, this is not being done. Only the heart is being tested. So thank you for writing in terms of that editorial. What do you think, Bob?
I think that was a great overview of the treatment. Now, I tell my patients when I first start is you got to walk till it hurts and keep walking. And everything that we've talked about medical therapy wise doesn't take the blockage away. You still have the blockage and it's still going to hurt. You'll just be able to go farther before you get to the pain part. The only thing that's going to take the blockage away, and it's not a cure, mind you, it's not a cure, is to either get a bypass or to let someone like myself, an endovascular physician, get in there and open the arteries up. That will take the pain away, but remember, it's a treatment. Those blockages,
lifelong treatment.
It's a lifelong treatment. When I usually tell my patients this is the first visit of a long relationship we're going to have. You got everything that we've talked about to try and prevent the blockages from recurring and coming back is all treatment, and we want to make it so that you have a good lifestyle, but also a long life.
Right.
So we're addressing the 2 components, trying to keep the heart attack at bay with all the medical therapy, but also getting you and the exercise that you're going to get that makes your legs feel better. And the studies have shown exercise is always the mainstay of therapy. The exercise is not only good for your legs, it's good for your heart, it's good for your mental status. So get out there and exercise. And if you're limited by your lifestyle, you see someone who can treat you.
But that exercise but I'm sorry to interrupt. The exercise is going to improve your mortality too.
Yes, yeah, exactly.
Because you walk further if you do that exercise rehab, so to speak. There's been studies to show
it's interval training. It's you get on the treadmill, you walk till it hurts, and then you keep going, and you do that in an exercise plan. And so,
this is such a love of Dr. Kaiser's. I really wanted to make sure that he was heard well today. That's it for this week. Tune in next week, and this is his second area of expertise for a very exciting topic, folks: nukes versus CATs, the pitfalls of nuclear stress testing, and the promise of CAT scans to better detect your heart disease. As always, sign up at smarterheartuniversity.com. View and listen to our now 16 shows and learn with us every single week. Remember, as always with us, get to it before it gets to you. Have a beautiful day, stay safe, and we'll see you next week on smarterheartuniversity.com.